Okay, my presentation is about language delay, possible causes. What is language is my first question. The method of human communication. It can either be spoken or written. It consists of the use of words in a structured and conventional way. It's a system of communication used by a particular country or community. That's how most of the universe communicates. Language delay. A language delay is a language disorder in which a child does not meet required language developmental milestones. A child will struggle with expressing their emotion and their needs because of the lack of speech. Language delay, it can be receptive, expressive, or a combination of both. Receptive meaning a child has difficulty understanding a language, or expressive happens when a child has difficulty communicating verbally. That is where speech and language are two different things. Language is the way that it is understood, and speech is how a child actually speaks and expresses themselves.
Why is he flying in a ball?
Shh. Some language delay symptoms include not babbling by the age of 15 months, not talking by the age of 2, inability to speak in short sentences by the age of 3 years, difficulty following directions, poor pronunciation, difficulty putting words together in a sentence, and leaving words out of a sentence. Language delay symptoms can be noticed as early as 1 to 2 years old, and that is something that can be caught by either parents or doctors. Language delay possible causes. There are many possible causes. Hearing impairment, numerous ear infections could be the reason of language delay. Developmental disorders like autism, cerebral palsy, and several other disorders can include language delays. Learning disabilities, future academic struggles with reading, writing, and spelling. That language delay could lead to even larger struggles in education. Exposure to more than one language. If a child's family speaks English and Spanish at home, that child might become confused and have difficulty expressing themselves. Child neglect. When a child is neglected, they lack many social skills. If a child is ignored, is not involved with parents, doesn't communicate, that could really end in a language delay. A diagnosis is done through a medical assessment. A speech and language pathologist referral is made by the doctor. The earlier the delay is caught, the better. Speech pathologist then performs a comprehensive assessment on child to determine the severity of the delay. A hearing exam could also be performed to determine or eliminate possible causes. Treatment. Treatment is either speech or language therapy. A child will go every so often depending on his or her needs. Primarily, an evaluation is performed. Then pathologists will implement a plan specifically for that child to cover their language needs in each visit. They might do things like just playing, narrating everything that they're doing, shapes, colors, numbers. Just talking in general is what will help that child. How language delay affects a child and family. A language delay can cause a lot of frustration. It can be overwhelming for both child and family to not comprehend one another, whether it's child not understanding parent or vice versa. Stress, if not handled well, it can end in yelling, and child can experience an even larger emotional breakdown. Socially, language delay could really affect a child's socialization, making it difficult to make friends. Everything revolves around talking about and socializing. So when a child cannot express themselves, cannot express their needs and their thoughts, that could really put a barrier on their social skills. How to encourage language development. You can start by talking to even a newborn baby, a toddler, a child, always just interacting with them. Avoid the baby talk. Narrate activities to child with comprehensible details. respond to your child's babbling when they're a baby, sing to your child even if they're infants, read aloud to your child every day if possible, answer your child's questions, treat ear infections promptly, limit television and tablet use, dance and play with your child. Seeing them grow into happy and social people should be every parent's goal. Language. A language delay can truly benefit from intervention and therapy. The younger a child receives help, the better. It is very probable that a child will catch up with the right help. Interaction at home is also very important. So it's also important that not to just leave it to the schools and the teachers, but it all starts at home.
Amanda.
And that is my possible delays for my possible language delays.